MBA Holistics has a network of alternative medicine practitioners, chiropractors, massage therapists, traditional chronic pain doctors, and we have added medical cannabis. So a lot of our patients are contacting us wanting to know what our services are and how we can help. So one of the ways that we help patients is by referring them to our network of doctors.
A very close personal friend of mine had a couple very serious situations occur in his life. One is he slipped on the ice and broke his spine. His lumbar spine he fractured, and he was taking medication for that and actually got hooked on the medication, OxyContin. It's happening a lot these days. So that was the first situation that happened in his life. The second situation is that his spouse committed suicide. And he found that person, and that was very traumatic, obviously, and that only increased the amount of medications that he was taking. The negative impact on that was he lost his spouse, obviously, but he lost his business and he lost everything. So I can understand from a personal level the effects that opioids have on people when they get addicted to them. And there has to be alternatives out there for people. So I'm really happy that you're reaching out to me with the medical marijuana and the cannabis community to help. Chiropractors have helped for many years with chronic and acute pain using different modalities. One of them in particular, chiropractors are known for their adjustments, right? Adjustments obviously help areas of the spine maneuver a little bit better because they're positioned better. But I think what people don't know is how that happens physiologically in the body.
So a lot of the patients that are referred to us or contact us are dealing with chronic pain issues, whether that comes from an accident or from a degenerative process. A lot of it's related to spinal cord injuries. And I understand you're working with cold laser, and so I think it's really important for all of us to understand exactly what cold laser does and how it helps with chronic pain.
So, cold laser therapy is another thing that we're very excited about in the chiropractic community because we can help so many people with acute pain and chronic pain. Obviously, from the name cold laser, you would think it's cold. You don't really feel anything with the cold laser. It acts on the cellular level. Typical treatment lasts 7 to 10 minutes. It helps by reducing pain and inflammation at the cellular level. Very beneficial for athletes who have muscle sprains and strains, chronic degenerative disorders, disc disorders, joint disorders. It's been effective for carpal tunnel syndrome. It's been effective for TMJ.
So coming from a chiropractic standpoint, can you tell me some other ways that chiropractic can help with chronic pain?
Other things that we do in our office, one of the other exciting modalities that we have to treat patients for pain is spinal decompression. So this is a modality for patients that are not candidates for surgery. This piece of equipment helps people with herniated discs, bulging discs, decompresses their spine, so basically it takes off that negative pressure that's impinging the nerve, causing pain locally or radiating or referred pain. Dry needling is another concept that we use to help with chronic and acute pain. So rapid release is kind of new concept, but it helps very effectively with people who have scar tissue from old injuries. Scar tissue can restrict range of motion. It can actually put pressure on the nerves. The rapid release does high frequency vibration to strip out muscle fibers so that the muscles can respond more normally to movement.
So in Maryland, medical cannabis is legal if you go through the process of getting your certification through the Maryland Medical Cannabis Commission. And once you've done that, you can go to any of the dispensaries that are open and get your medical cannabis there. So we worked together for many years, but as a massage therapist and you as a chiropractor working side by side. But my career took a dramatic turn about 2 years ago after taking care of a childhood friend of mine who had breast cancer. And I cared for her as a massage therapist for the last 18 months of her life. And it was an amazing process, and it changed the trajectory of the rest of my career in two ways, because we were able to treat her. She decided to use cannabis instead of narcotics because she has 6 children and a husband that she wanted to engage with, and the narcotics sedated her to the point of mostly being asleep. And so with cannabis, she was able to still be engaged and be a part of their lives. So through that process, and after she passed, this concept of how do we get more of the medical community to accept medical cannabis as a legitimate pain management option instead of just giving narcotics out. And there are times when that's necessary at end of life or if the patient needs that, but in many cases that we've seen, medical cannabis can be used with traditional medicine or alone. And in Jessica's case, she, for the last several months, was not on any narcotics and just used medical cannabis. So our message is, how do we get more people onto this concept of it's not necessarily just narcotics. One of the things that I've noticed as a MMCC patient myself, and also just visiting many dispensaries in Maryland, is that while their products are fantastic and there's a variety of products, it's not necessarily geared toward the medical community. And until we get to that place, I don't see that traditional medical practitioners are going to feel comfortable referring their patients into this system. And so if you look at just the statistics, according to the MMCC website, there's just under 300 hospice patients that are registered into the program. And we know that at any given time there are over 10,000 in Maryland. So there's a great difference, and we know that the medicine is not getting to the people that really need it. So we act as a third party that can bring those two groups together.
A lot of people understand that chiropractors help with pain through the chiropractic adjustment, low back pain, neck pain, things like that. I think what most people don't know is how the chiropractic adjustment helps with the pain physiologically in the body. So I just want to help people have a better understanding of that concept. So we have something called nociceptors in our body, and we have something in our body called mechanoreceptors. Nociceptors in our body respond to an assault on the body and produce pain. They send a signal to the brain and the spinal cord that there's some bad event occurring in the body, so they produce pain. Nociceptors are all over the body. Okay, they're in muscle, nerve, bone, even our organs. Mechanoreceptors are also throughout our body, but mostly along joints, especially in the spine. They are sensors in the body that respond to pressure. Okay, when a chiropractor performs an adjustment, he's putting an impulse into the spine, and when that event occurs, it stimulates mechanoreceptors, particularly those around the spine or the area that you're adjusting. What mechanoreceptors do is they block nociceptors, okay? In particular, a chemical response that the nociceptors are responsible for, something called substance P. So when an adjustment is given to a patient, the mechanoreceptors are stimulated, they block any kind of pain signal, thereby diminishing pain that people feel.
Oftentimes when people think about alternative medicine, they may think of chiropractic, acupuncture, different modalities, but now with medical cannabis being legal, I think treatment plans should involve using medical cannabis, particularly with the opioid crisis and wanting to rely on things other than just prescription medication. Having worked with the chronically ill population and palliative care and hospice for over 10 years, I have a lot of experience with what it looks like at end of life and when people are in chronic pain. And I very much understand why narcotics have been used to handle that pain. But in the last couple of years, we've seen huge growth in medical cannabis and how that can really help in the overall treatment plan or be substituted for traditional narcotics to handle chronic pain. One of the things that we're trying to accomplish at MBA is to really bring the medical community to the medical cannabis community. Right now there is a separation, and with our network of pain management doctors, alternative medicine practitioners, and with our connections and partnerships with medical cannabis, we'd like to bring all of that together to allow for a better outcome for patients so that they can be active in their lives, so they're not stuck on a cycle of opioids and needing more and more and becoming more sedated and just not being active in their lives. Having worked in many offices and managed different types of medical practices, moving into the medical cannabis world, it was a little bit shocking to me to see that it wasn't necessarily a medical model in the dispensaries. I think many of the dispensaries do a great job at educating their employees, but it's truly not a medical model. So MBA Holistics wants to make the entire process from signing up for your MMCC certification, following along with your progress once you start using the medical cannabis, so that there's a comfort level between the patient, the referring doctor, their team of doctors that are handling their chronic pain, and the cannabis community. And bringing all of that together, I think, completes a treatment plan that works holistically for the patient, and the outcomes I believe, will be generally better.
So I'm really excited to be part of the network of alternative medicine practitioners associated with your group and helping those people suffering with chronic pain.